my name is Rachel Hohlweg, and this is my dad, Mike Hohlweg. We're the authors of Pain-Free Foods. We know that there's a lot of different treatment options out there for people that are suffering from diverticulitis, and so today we want to talk about some of those.
The way I look at it, there's actually 3 or 4 main treatment options, and I think a couple of them are devastatingly hard on a person with diverticulitis, so we wanted to kind of cover them all. One of the main ways that a person is usually treated for diverticulitis, especially if they go to a doctor or hospital during an attack or flare-up, is with antibiotics. And Rachel and I consider, first of all, we're not doctors and we're not trying to contradict anything your doctor tells you. But in general, we feel that antibiotics are severely overprescribed and that they are devastating to the digestive tract. Remember, your digestive tract is just a tube filled with bacteria that digest your food. So while in many cases you do have to take antibiotics to recover from an attack or flare-up, one of the things that can happen when you take these strong new superbug antibiotics like Cipro and Flagyl, for instance, is that your own immune system, which 70%, 80% of your immune system is your intestinal bacteria, and as much as 1/4 to 1/3 of that can be wiped out with each round of these new super antibiotics. So when possible, and not contradicting your doctor's advice, we suggest avoiding that as much as possible, rounds of antibiotics.
I've worked with a lot of clients that come to us while they're on antibiotics and while they're on steroids and a few different medications that are supposed to help. Some clients do well on them for a while, and so I'll have people come to me and say that, I've been on this and for the first few months it worked wonderfully, all my symptoms ended, side effects started getting too extreme, or it just stopped working, I'm nauseous all the time, it doesn't seem to help with the pain. And so after a few months, it seems like in a lot of cases, according to clients that I've talked to, the side effects get to be worse than the symptoms they were dealing with to begin with. And so they're paying for these astronomically priced drugs and they're not getting the results they want from them, and they're being medicated. So your digestive system's compromised, you're surviving just because of medication. It doesn't seem to be a good long-term solution. I've never been on these drugs personally, but I'm just telling you what clients that I've spoken to have told me, that they just think steroids and things aren't a good long-term solution.
Okay, I look at it and I think there are basically 4 treatment methods, and so we've just covered 2 of them because antibiotics is one of the most common treatments, and you just covered drugs, I think, very well. The third thing that some people consider to be part of treatment, because it's what happens when they go to the doctor or the hospital, are procedures. And procedures for, as a form of diverticulitis treatment generally amount to things like scopes, like a colonoscopy or that type of thing. We look at these types of treatments as being more diagnostic than treating. One of the ways that your doctor can look inside your body and see what is actually going on, what damage is there, how long it might have been occurring, where it is located, and usually I think they're looking at it to see if you're close to a required surgery, or if some of the drug prescription that they have at their disposal might benefit you. So we don't actually look at that as a treatment, but it is sort of a form of treatment. Those are 3 of the 4, and the last of the 4 we consider to be a change in diet, because we consider diet to actually, in our opinion, be the cause of diverticulitis, directly and indirectly. Rachel could take a minute and discuss why we consider diet to actually be a treatment method for diverticulitis.
Basically, we've coached 10,000 people or more each, and in all cases we're coaching them on the diet that they're doing that we created, and within a few days to a few weeks, over 99% of clients report that they're doing awesome. And so the reason that we believe that it's diet caused and diet fixed is because of our experience and because of the diet that we have available and what we're doing and the client feedback that we get. And so if you ever doubt us or think that, okay, I don't want to listen to you because your opinion is biased, truth be told, it is biased, because I love my clients and I work with them on a daily basis and I keep in touch with them ongoing, sometimes for years. I know personally what good the diet does. We've both been on it. But if you doubt us, go to Facebook. Go to our page. There's a link at the bottom of the page right now for the Pain-Free Food Support Group, and you can see what clients that try our diet are saying. And so when you change how you digest your food by what you're eating in a given meal, and you eat properly, your body has a chance to improve itself and has a chance to recover from the damage that's done over years. And your body is very good at recovering from things if you give it the chance and you create the right circumstances. So under our logic that diet causes diverticulitis, diet can also fix it, and we've proved it time and time again. We also have a free report that you can download, and there'll be a link at the bottom of the page as well, where we can prove it to you. If you don't believe us, try the free report and see what you think. Try it. You're not risking anything. You can always ask your doctor if he thinks it's a good idea. But in our opinion, based on research that we've been doing for years and years and working with tons and tons of clients, diet is exactly the solution that you're looking for.
Thank you.